Hi. So today we're going to discuss about what are the role or what is the role of a dhatu in a child with reference to the growth assessment. How dhatus will be grow, how dhatus will be formed for the growth of the baby, for the growth of the child. Today we're going to discuss about it. So the assessment of the status of the dhatu and rasa mamsa medasti, these are the dhatu parikshana. For doing the dhatu parikshana, how they will be developed, we're going to discuss about it. Status of a dhatu is examined in two ways. Mainly the status of the dhatus is examined on the basis of two ways, that is a qualitative assessment and quantitative assessment. So what is the qualitative assessment? Qualitative assessment on the basis of what optimal qualitative assessment is on the basis of optimal and proper function of each dhatu. What like a rasa dhatu, how they work, rasa after rakta, mamsa, meda, asti, how these dhatu are work, how they were or they are working on the optimal state. um, this should be discussed or assessed on the basis of the qualitative assessment, right? And quantitative assessment is on the basis of the praman of a sharir. What is the praman? Praman, that is the length of the body, or praman. And pariman, sorry, pariman, that is the assessment or measurement, and praman we can take as a uh, pramans means as a particular dhatu or a particular part, and that is okay. Pariman of a dhatu and measurement of the dhatu. So there is a direct reference of Sushruta Samhita. What Sushruta says in 15 adhyaya, that is a dosh dhatu malanam parimanam na vidyate. Without dosh and dhatu and mala, pariman should not be done. For a clinical direction, we take an example, or we will take as example, like for a clinical direction to decide treatment, we need to assess the magnitude or status of the dhatu in present situation, and hence we have biochemical or serological markers to assess the dhatu. Example, they have given serum electrolyte level, serum glucose. These are a modern point of view how we compare the rasa dhatu to the serum or serum glucose or protein etc things to the rasa dhatu, right? CBC count take complete blood count. CBC take for the rakta dhatu, the serum, iron, ferritin etc. These are taken as assessment for the rakta dhatu. These are modern plus ayurvedic correlations, right? Serum protein creatine has taken for the mamsa dhatu, and serum calcium level for the asti dhatu, we know about the bone, correct? So these are the correlations, or these are the qualitative and quantitative factors with reference to the child growth and development, right? So next, what are the pediatrics dhatu nirman in pediatrics growth, we will discuss the next step, right? So here how dhatu nirman or pediatrics growth will be happen, here I discussed. So what this says, dhatu are formed in a sequel manner, correct? We know about, we have studied in the first year, that is from rasa, there is rakta, mamsa to meda to asti to majja to shukra. But there are many controversies has been happen. Like I take an example, if the firstly form is rasa to rakta to mamsa to meda to asti, and asti to shukra. Then how dugdha or milk should directly gives portion to the shukra? These points are controversial. How the acharya has taken as a controversies regarding that. So here it is that tells about that sequel manners from ahara rasa, that is equal continue for the growth, right? The quality of a rasa dhatu affects mamsa, right? If a rasa is not properly formed, that definitely affects the rakta, and rakta is not formed properly, that definitely going to affect the mamsa, which in turn influence the meda and ultimately asti, correct? The interconnectedness underscores the holistic view of the growth. These interconnections should affect the growth of the baby or any organic matter, right? For example, poor nutrition status during early infancy, the rasakshay has been associated with a decrease in muscle mass. If nutrition is poor, then definitely is going to affect the baby, right? So they have clinical ramifications given. Ramifications has been given. Understanding the status of a dhatu in the context of a growth assessment has significant clinical ramification. Maintenance of the dhatu samya, these are dosha and dhatu samya, dosha dhatu malanam, they have given, that is dhatu samya, do ahara, dietary modifications, aushadhis, formulations, dinacharya, rutucharya, these things which have to taken as a prime aim of a chikitsa. These are things we have to think like a clinically, right? For the last point, they have discussed one clinical point. What is a clinical point? That is a praman sharir assessment is as equivalent as an anthropometrical measurement. What is anthropometrical measurement? It is a measurement according to what is the age of the baby and what is the weight and height should has to be, and which is happen or not. Next we will discuss about the chart regarding the anthropometrical measurement. What this is, which we are doing today, right? While qualitative assessment is a clinical observation of the functions of a dhatu, right? Qualitative, what we assess with the qualitative assessment, that is the functions of a dhatu or tissue functions which stand against the disease and maintenance of the health. Which is stands against what? Disease के अगेंस्ट काम करता है और मेंटेन द हेल्थ एंड विच मेंटेन्स द हेल्थ. सो नेक्स्ट पॉइंट वी विल बी discuss about the anthropometrical measurement. They have given in a chart. This is a chart for approximate anthropometrical values of, by age. If the age of the baby and they have given accordingly weight and length height should be what has to be approximately, right? Just born baby, we know in India the normal or approximately weight of the baby is 2.5 to 3 kgs, correct? The length should be 50 centimeters and head circumference has to be 34 centimeter. If the baby is of 6 months, it has to be double, that is a 6 kg weight, 65 centimeter height and head circumference is 43 centimeter. If the age of the baby is 1 year, then it has to be triple, that is a 3 3s are 9, correct? It has to be triple. The length is height or height has to be 75 centimeter and head circumference has to be 46 centimeter. If the age of the baby is 2 years, quadruples, that is 4 times of the born baby, correct? 12 kg has to be the weight, 90 centimeter height and 48 head circumference. After, if the baby is 3 years, it has to be 15 kg weight, 95 centimeter height and 49 centimeter of the head circumference. And if the age of the baby is 4 years, it has to be the high weight of the 16 kg, height has to be 100 centimeter and head circumference has to be 50 centimeter, right? These are the approximate and anthropometric value by age, right? Next we will discuss about what are the nutritional status like stunting, underweight and wasting, right? We will see that. So these are the points which are stunting, underweight and wasting. First of all, these are points are a subtype of undernutrition. If the baby or anyone who is suffering from stunting, underweight and wasting, it has comes under or considered as a undernutrition, correct? What is the underweight? Underweight, we know that low weight of the baby with consider to the age, that is if the age of the baby is approximately we have recently seen in chart has to be 4 years, and if the age of the baby is 9 to 10 kg, it is underweight baby, right? What proximal value has to be, that is if the baby age is 4 years, it has to be 16 kg of the weight, correct? So the child what this is, the child weights less than a minus 2 standard deviation 2 according to WHO, right? This should be considered as an underweight child. Stunting, wasted किंवा both पण म्हणतो आता. What is the stunting? Low height for the age. If the baby height, we have recently seen in chat what if the baby age is 4 years and height has to be approximately 100 centimeter, but height is 75 or 65 centimeter, which will be considered as a stunting. According to the age, the height of the baby is not correct according to WHO standard. This should be considered as a stunting. Same for the weight. If the weight of the baby according to his height has to be it is a less, then we will consider as a wasting. Low weight for a height. If we can take as an example for what weight, if the height of the baby is 100 centimeter, the weight has to be 16 centimeter, correct? But if the weight is a 9, that is a triple of the weight of the born baby, that is a 9 triples, it is considered as a wasting. So these are the terms according to WHO standards as considered as a underweight, stunting and wasting. Okay, thank you.